Howdy, my name's Heather Mambretti. I'm physician assistant working at Rheumatology for the past 10 years in the Houston, Texas area and member of RAP. Today we'll be going through the Immunologic Rationale for IL-23 directed therapy in psoriasis, psoriatic arthritis, and inflammatory bowel disease. Interleukin-23 directed treatment has demonstrated efficacy for treatment of autoimmune diseases like PsA, psoriasis, and inflammatory bowel disease like Crohn's and ulcerative colitis, because of the central role that interleukin-23 plays in orchestrating the downstream inflammatory response. IL-23 is a cytokine that is produced primarily by dendritic and macrophage cells, and it is a critical regulator in the differentiation and maintenance of Th17 cells, which are a subset of CD64 positive T cells implicated in chronic inflammatory processes. In cutaneous psoriasis and psoriatic arthritis, dysregulation of IL-23 signaling leads to the downstream proliferation and activation of Th17 cells in both the skin and the joints, which results in the production of pro-inflammatory cytokines like IL-17A and IL-17F. In the 2021 publication in Rheumatology journal titled IL-23 Skin, Gut, and Joints, the authors reflected on IL-23's linking role in multiple inflammatory processes across systematic domains. In the context of inflammatory bowel disease, IL-23 signaling can drive the differentiation and activation of Th17 cells in the gut mucosa, and Th17 cells go down and produce IL-17 and other pro-inflammatory cytokines, which can disrupt the intestinal barrier function and promote inflammatory infiltration, thereby perpetuating the chronic inflammatory process involved in Crohn's and ulcerative colitis. IL-23-mediated Th17 cells are intricately involved in the pathogenesis of IBD. Therefore, that makes IL-23 blockade a promising target for mitigating the ramifications of intestinal inflammation related to IBD. By specifically inhibiting IL-23 signaling, these agents can selectively block the inflammatory cascade downstream and decrease the expansion and activation of Th17 cells in the skin, the joints, and the intestinal mucosa. The success of IL-23-directed therapies in multiple clinical trials underscores the importance of IL-23 pathogenesis in PsA, psoriasis, and inflammatory bowel disease. These agents have demonstrated efficacy in reducing disease severity, improving clinical symptoms, and enhancing the quality of life of our patients with inflammatory conditions like psoriatic arthritis, cutaneous psoriasis, and inflammatory bowel disease. For more information on guselkumab, please see the RAP website or the RAP ACE app. Thank you.